Hello guys, today our topic is Meniere's disease. We'll study Meniere's disease. It is the disease of inner ear. Meniere's disease, it is also called as idiopathic endolymphatic hydrops. The term there is endolymphatic hydrops, that is excessive accumulation of endolymph within the membranous labyrinth. Now we can define Meniere's disease as it is a disorder of inner ear where endolymph increases leading to the dilatation of membranous labyrinth. There is increase in the endolymph within the membranous labyrinth, and this lead to the dilatation of this membranous labyrinth where there is excessive accumulation of endolymph due to increased production or decreased absorption. Now this Meniere's disease generally characterized by triad of symptom, and the triad of symptom are the first symptom it is vertigo, and the second symptom are sensorineural hearing loss and tinnitus. The vertigo is generally a first symptom, and its occur usually last for about 20 minutes to 2 to 3 hours and may last for around 24 hours, that is less than 24 hours. This Meniere's disease is generally, most commonly, it is unilateral. It is a unilateral condition, so that only one ear is affected, and more common in young female between the age group of 20 to 40 years. Let's start etiopathogenesis. Etiology, let's study on etiology. The exact etiology of this Meniere's disease is unknown. Exact cause is not known, but various hypotheses have been postulated accordingly. Number one is psychological stress. With the increase of psychological stress, there is the vasomotor disturbance. There may be increase in the vasodilation, and this vasodilation lead to the excessive secretion of the endolymph within the scala media. Maybe there is the sodium and water retention, and decreased absorption means there is endolymphatic sac obstruction. Now we study about the disease, that is secondary Meniere's disease, which has the secondary causes. They are infection, allergy, autoimmune or immunological, trauma, endocrinological, and hereditary. Hereditary might be caused by mutation on the short arm of chromosome number 6. This is the past question. This is the past question asked. Now let's revise slight anatomy of inner ear. This is the cross-sectional view of cochlea. Cochlea is generally torn within the petrous part of temporal bone, and we have cross-sectioned the cochlea to view this type of view. This cochlea is divided into three parts, that is scala vestibuli, and then scala media, the middle one, and the lower one is scala tympani. Now this scala vestibuli is filled with perilymph. This is filled with perilymph, and this scala tympani is also filled with perilymph. But this scala media is filled with endolymph. This consists of endolymph, and this is the regional membrane, and this is the organ of Corti. This organ of Corti generally lies on this basilar membrane, and these are the inner hair cell, and this is the outer hair cell. This is the tectorial membrane above the outer or inner hair cell. And in this scala media, in this portion there is the vascular layer or vascular lining. These are the vascular lining. This is called as stria vascularis. Inner ear is divided into bony labyrinth bony labyrinth, and within it there are membranous labyrinth. This bony labyrinth is filled with perilymph, which is rich in sodium ion, and this membranous labyrinth is filled with endolymph, which is rich in potassium ion. Membranous labyrinth generally present all over the inner ear, that is scala media, utricle, sacral, and even in the semicircular canal. This is the concise picture of inner ear. We can see perilymph in scala vestibuli and scala tympani, and endolymph in scala media. This is the oval window, and this is the round window. And this perilymph is connected with the subarachnoid process so that it can flow from here inner ear to mix with CSF and finally to the arachnoid villi, subarachnoid space. Now we go through the mechanism of Meniere's disease. These are some mechanism we will study. Mechanism are this Meniere's disease. It is idiopathic endolymphatic hydrops, and it may occur due to increased production or decreased absorption. Decreased absorption is due to endolymphatic sac obstruction, and increased production may be caused due to different hypotheses we have postulated above. That is maybe due to salt and water retention, and production of endolymph from the scala media is through stria vascularis. We have already told about this stria vascularis. This leads to the excessive increase of the endolymph in membranous labyrinth, causing the pressure on regional membrane. This causes pressure on the regional membrane. This membrane separates scala vestibuli and scala media, so that the regional membrane bulges and finally rupture. If this membrane get ruptured, the mixing of endolymph and perilymph occur. The mixing of endolymph and perilymph, since endolymph is endolymph had high concentration of potassium ion and perilymph had high concentration of sodium ion. So the mixing of this ion chemically or transiently irritate and damage the vestibular and cochlear nerve. When the vestibular and cochlear nerve get irritated, leads to the depolarization, blockade, and transient loss of the function of vestibular and cochlear pathway. This leads, if there is the depolarization, blockade, and transient loss of the vestibular nerve function, then there occur vertigo. And if there is the transient loss of function of the cochlear pathway, there occurs sensorineural hearing loss and tinnitus. Let's describe this from our figure, which we have described already. This is our figure. When there is excessive production of the endolymph, when there is excessive production of endolymph within the scala media by stria vascularis, the lining of stria vascularis is here. The excessive production lead to increased pressure within the scala media. This lead to the bulging of regional membrane. In this way, the regional membrane get bulged, and finally it rupture, so that the endolymph from scala media and perilymph from scala vestibuli get mixed to each other, and this mixture irritate this nerve. That is, this nerve is cochlear nerve, and finally they irritate vestibular nerve also. So this irritation produce vertigo and sensorineural hearing loss and tinnitus. These are the classical symptoms of the Meniere's disease. Some of the variants of Meniere's disease are, first variant is drop crisis. Drop crisis is also called as Tumarkin otolithic crisis, or it is also called as drop attack. How this occur? We go through the mechanism. Because of the dilatation of utricle and sacals, there is the distortion of the macular membrane and affecting the linear acceleration. When the patient walks, he or she suddenly falls without any loss of consciousness. and this is called as drop crisis. The patient have feeling of having been pushed into the ground by somebody. And another variant is Lohr-Moyes syndrome. This is the another variant, uh, that is Lohr-Moyes syndrome. Lohr-Moyes syndrome is the reverse of Meniere's disease. That is, the symptom which occur first in Meniere's disease is vertigo, but the symptom occur first in Lohr-Moyes syndrome is sensorineural hearing loss and tinnitus, and second symptom is vertigo. This is just opposite of Meniere's disease. And here the symptom of Meniere's disease are seen in reverse order. This is the fact, and that is reverse order of Meniere's disease symptom. First, there is progressive deterioration of the hearing followed by an attack of vertigo, at which time the hearing recover. Other variant are cochlear hydrops, and vestibular hydrops, and Matterhoff sacculovestibular response. These are the variant of Meniere's disease. Have almost same symptom. Let's go through the clinical feature of the Meniere's disease. Clinical feature are first clinical feature is vertigo. First clinical feature is vertigo, which is sudden in onset associated with the vagal symptom. Vagal symptom are like nausea, vomiting, abdominal cramp, diarrhea, and bradycardia. May be associated with ataxia and nystagmus. This nystagmus or ataxia lasts for about 20 minutes to 2 to 3 hours. Let's discuss one of the phenomena which generally asked within the internal examination, the condition where the loud sound produce vertigo. Condition in which any of the loud sound produce vertigo, this is called as Tullio phenomenon. Mechanism of Tullio phenomenon, this generally occur in Meniere's disease. When there is excessive production of the endolymph within the scala media or in saccule or utricle, there is the dilatation of utricle and saccule. This makes utricle and saccule to lie very near to oval window against the established foot plate. When when there is any loud sound or noise, the foot plate of staph is directly stimulate the saccule and utricle. This lead to vertigo, and this is a Tullio phenomenon. Now we discuss about sensorineural hearing loss. This is the second symptom, and sensorineural hearing loss and tinnitus. This improve after an attack and fluctuating type of sensorineural hearing loss. This is the characteristic feature. Fluctuating type of sensorineural hearing loss is the characteristic feature of Meniere's disease. Tinnitus is of low pitch, roaring type. Sense of aural fullness or pressure may be seen. Now we will discuss some of the questions regarding Meniere's disease that we have studied already. The sensorineural hearing loss in Meniere's disease is characterized by the sensorineural hearing loss is characterized by what we accept. This is the correct answer. Low frequency hearing loss initially. In Meniere's disease, first involved portion is scala media. Scala media is the inner portion, so that low frequency hearing loss initially goes, and later on both low and high frequency hearing loss occur. Another question is, fluctuating hearing loss is the feature of. We have already studied fluctuating hearing loss in Meniere's disease, but fluctuating hearing loss may occur in labyrinthine fistula, Lohr-Moyes syndrome. So the answer is all of above. Answer is all of above. Tullio phenomenon is seen in all except. Tullio phenomenon generally occur in Meniere's disease. We have already studied. And perilymph fistula, there is the imbalance of endolymph, and superior canal dehiscence. Also there is endolymphatic system. 1, 2. So the answer is otosclerosis, in which endolymphatic system is not damaged. Let's stop here. Thank you.